at birth, we have an equal propensity to be either left-sided dominant or right-sided dominant. However, over time, one of our sides of our brain takes over. When you hear us mention that a person is left-sided dominant, we're talking about where your dominant language hemisphere is. That's all that we mean, okay? So 90% of people are actually going to be left-sided dominant, all right? So what side of your brain does what? This is how I remember it. Left side of my brain is my book smart side. The right side of my brain is my more artistic side, okay? The left side of your brain, number one, that's usually where Broca's area and Wernicke's area are, which give you the ability to speak, to understand what people are saying to you, and for you to be, people can understand what you're saying to them. So that's that side of your brain. Also on the left side of your brain, your ability to be logical is there. Your ability to do math and science is there. And also 80 to 90% of people that are left-handed are also left-sided dominant, okay? Whereas the right side of your brain is more artistic. So it's where visual spatial perception is, gives you ability to comprehend nonverbal information, gives you ability to appreciate music, process information, recognize people's faces, and then also understand what people's facial expressions mean, okay? So again, left side of your brain is more book smart side, right side of your brain is just more artistic. Easy way for me to remember it, at least. Before you do the neurological exam, you have to take into consideration a couple pearls and pitfalls. Number one, take into consideration the time of day. If somebody wakes a patient, if you wake a patient up at like 5 o'clock in the morning with a stroke, give them time to wake up, okay? Don't just automatically wake up, start asking them questions, and when they give you the wrong answer, you start marking them negative for things, okay? If someone would have woke me up this morning at about 5 o'clock in the morning, I doubt that I would have said Cherry Creek is where that I was, okay? I need time to get my bearings straight, realize what hotel I'm in, where the bathroom is today, you know, now put a stroke inside someone's head. It takes a lot more time to process, so let them wake up a little bit more. Pain and fatigue also play a role in a patient's overall neurological exam. Therapy, if a patient's in pain and tired, they're not going to want to go down and do therapy. They're not going to want to give full strength. They're not going to want to give full effort. So take that into consideration. Also, take into consideration a patient's history. A patient could have a history of dementia, Alzheimer's. That's going to skew your neurological exam. Patient could have tore their rotator cuff at some point in their life, and now their arm only goes up this high instead of way up here, and it gets weak really quickly. Patient maybe has arthritis, so you do grasp, and it's not that strong on that hand. Well, it's arthritis that's doing it, not the deficit from their brain. Also consider a patient's educational and social background. Not every patient can read or write. Not every patient can do mathematics. So when you're asking the patient these things, just because they get them wrong doesn't mean that it's because that side of their brain is damaged, okay?